we are able to flatten the curve. And as a Ministry of Health, we've adopted a community-based approach. We've reiterated this in the past few days, that this approach is being handled together with county governments, and it's central to our response to coronavirus. It will center on community health, and particularly with regards to COVID-19 related measures. And as a strategy, it's important to note that this community health-based approach has been globally recognized to be an effective pathway with regards to improving healthcare delivery, touching on all diseases, all burdens of diseases, and contributing to health and socioeconomic development. And it is also important to note that this approach forms a key pillar of the primary healthcare approach, an approach that Kenya has adopted together with numerous other countries, as was committed in the Alma Ata Declaration about 42 years ago, and further reaffirmed in 2018 in Kazakhstan. As a Ministry of Health, we do have strategic plans that are guiding this community-based approach. We currently are implementing the second strategic period approach, 2014 to 2019. And this plan, as reiterated, really looks at strengthening community structures, ensuring that systems are effective for implementing community health actions, and that there's also strengthening of data demand and information for use at all levels. We are looking forward at the end of this financial year to begin a new strategic plan again that will look to further enhance these measures when it comes to community health strategy and ensuring that we are able to utilize this great resource in terms of COVID-19. Currently, we are at 60 level of implementation in terms of community health in the country, and we expect to continue beefing up. And this forms part of the UHC agenda with the aim of ensuring that we have an additional community health volunteers onboarded in all the 47 counties. With regards to our COVID-19 situation, we currently have 278 people who have tested positive out of 4,074 samples which were run in the last 24 hours. This now brings our total tally of positive cases in the country to 5,811. And a cumulative number of cases conducted so far, 162,478 tests. Out of today's cases, all except 2 are Kenyans, and according to gender, we have 181 of them being male and 97 of them female. The youngest is 1-year-old infant, whereas the oldest is 84. And the cases are distributed as follows in terms of county disaggregation. Nairobi leads with 171 cases, Mombasa has 37, Nakuru 17, Kiambu 12, Busia 10, Uasin Gishu 9, Kajiado 4, Migori 3, Kericho 2, Machakos 2, Nandi 2, Trans Nzoia 2, Siaya 1, Taita Taveta 1, Kwale 1, Kisumu 1, Makueni, Meru and Vihiga all having 1 case. The cases are distributed in various sub-counties across all these different counties, and I'll give a highlight of some of these. In Nairobi, again, as mentioned in the past, we have Westlands leading with 34 cases, Langata 28, Dagoretti North 17, Makadara 16, Kibra 11, Embakasi East 10, Kasarani 9, Embakasi South 8, Kamkunji 8, Starehe 6, Embakasi West 5, Dagoretti South 5, Embakasi Central 4, Roysambu 4, Mathare 3, Ruaraka 2, Embakasi North 1. In Mombasa, Mvita leads with 14 cases, whereas Nyali has 6, and the least are in Changamwe having 2. In Nakuru, we have Nakuru East having 8, Naivasha 6. In Kiambu, we have Kiambu Town having 5, Kikuyu having 3, we have Thika having 1. In Uasin Gishu, the 9 cases are from Ainbekoi, 3 from Kapsaret, 2 from Keses. In terms of Kajiado, we have Kajiado North having 3, Kajiado East having 1. In Kericho, we have 2 cases from Ainamoi. In Machakos, the cases are from Athi River, 1 from Athi River Town, 1 from Machakos Town. In Nandi, we have 2 cases from Chesume. Trans Nzoia, 2 cases, all of them in Kwanza, whereas in Siaya, we have 1 case in Jem. In Taita Taveta, the case is in Voi, in Kwale, in Matuga, Kisumu, in Kisumu Central, and in Makueni, the case is in Kilome. In Meru, we have 1 case in Igembe South, And in Vihiga, we have the case in Vihiga town. Today, we are happy to report that we've discharged 31 patients from various hospitals, bringing to total 1,936, the total number who've recovered so far, and we continue to salute our healthcare workers for this commendable work. Unfortunately, we've lost another 4 patients to the disease, bringing our total fatalities to 141, and our sincere and heartfelt condolences go to the family and friends of the departed. On a related matter, we have noted with a lot of concern incidences of COVID-19 infections have arisen, and particularly due to cross-infection in healthcare facilities. And this is a matter that the ministry has taken seriously, and we would want to appeal to all hospitals, public and private, to be extremely careful to ensure that they put in place measures that reduce the possibility of cross-infection. The ministry reminds each and every partner that we shall continue to work together to ensure that regulations are adhered to when it comes to preventing cross-infection at the hospital level. And in conclusion, we'd like to again appreciate our healthcare workers for their COVID-19 participation and response in the country, and we continue to prioritize their protection and to support them. We thank you all for your support, and we do remind you to continue adhering to all containment measures. Asanteni. Questions?
Thank you very much.